How often should you poop? Many Indians believe that once a day, every morning, you have to pass stool for a good gut health. As a gastroenterologist, I'll tell you this might surprise you. Daily bowel movement, it's not a requirement for healthy digestion. This kind of an obsession actually damages some people's gut. Exactly how many times one healthy person should poop? Let us look at the science. Please do subscribe to Bangalore Gastro Center Hospital's educational channel for more digestive health videos. Let us look at what is normal bowel movement. If I talk from the medical terms, it can range from 3 times a week through 3 times a day. It is that kind of a wide range. If you fall anywhere in this range, you are feeling comfortable, you don't feel bloated, you don't have any abdominal pain, you don't feel uneasy, then don't worry about it. Your digestion is still completely normal. Your body is not accumulating toxins. Just because you don't pass stool one day, you don't accumulate toxins in your body. Why Indians are obsessed with passing motion every day? Let us see. This belief is so strong in our country partly because of childhood conditioning. Parents emphasizing to the kids that you should pass motion every day in the morning, you should poop before you go to school. So there is a childhood conditioning that happens. Secondly, there is a lot of emphasis by Ayurveda on cleansing the colon, bowel cleansing, cleaning the colon of toxins, fear of toxins getting accumulated. And also what happens is there is a overuse of all kinds of these so-called safe natural remedies, Triphala, Isabgol, Churan, this, that and the other. A lot of social media nonsense about gut cleansing, cleaning the toxins in the colon. So this has created a lot of this toilet anxiety where people are panicking about the timing, how many times they should go. So this starts to cause various issues, including ruining their gut health. As a gastroenterologist, we do not focus on how many times you actually poop. What actually matters is, firstly, let us look at healthy bowel movement. Healthy bowel movement means you are passing soft stool, formed stool that is not too dry, that is not very hard, it's not like small pellets. So there is no excessive straining that is involved to pass this stool. Stool comes out easily. When you go and sit on the toilet, couple of minutes, job done. There is no pain in the abdomen, there is no pain in the anal area. You do not see any streaks of blood in the stool. But once you pass motion, you get the sense that it is fully evacuated. So you can tell that, look, I am done, everything is empty, I feel great. A person who is going every other day, alternate day, comfortably with no other symptoms is actually healthier compared to somebody who is trying to force pass the stool every morning without sometimes even getting the proper urge. So they're trying to push something that is not coming out. So this can lead to long-term unhealthy toilet habits. Next is the consistency of the stool. From the medical perspective, it's not about how many times, how frequently you're going. What is the consistency of your stool? Naturally, if the stool is very dry, if it is very hard, it's small, it's very pencil thin, you're constipated, which means that you will end up straining. You might also get that sense that you're not clearing properly. Secondly, if the stool is very loose, watery, runny, obviously it means that you're having diarrhea. This might be just a short duration for a couple of days, or it might be going on for long term. So depending on how long it's been going on, it might require further evaluation, because having loose stools repeatedly or going on for weeks together, that is not normal. People often complain of this sticky, pasty type of stool. They also feel that even though they go to the toilet, there's always something that is inside. They don't get the sense it's clearing properly. So this might indicate there are some gut issues, including bacterial overgrowth, some dysfunction, sometimes pelvic floor issues. So ideally speaking, the stool should be soft, formed, easy to pass. Forcing daily bowel movement with laxatives can be harmful. What happens is you start to depend on it. You train your bowel to become lazy. There are 3 issues which people get confused. Firstly, IBS, irritable bowel syndrome. This is a condition where you have a lot of symptoms without any disease in the gut. So this is a brain-gut axis issue related to stress, anxiety, poor sleep pattern, overthinking, variety of other issues, even including depression. Patients with IBS, sometimes they can alternate. Not every day is the same. Sometimes they might have constipation. Other times they might go multiple times in a day. They may experience bloating often, which is one of the common symptoms in IBS. They also have frequently abdominal discomfort, cramping, pain that usually gets relieved after passing gas, after passing stool. A lot of people with IBS have these symptoms. They somehow learn to live with it, they self-manage, and over a period of time, as their mental health, their stress levels get better, the symptoms disappear. Secondly, there are people who are only suffering with chronic constipation, which means they are passing less than 3 times motion in a week. Their stool is generally dry, hard. They are sometimes sitting in the toilet for half an hour, 40 minutes, putting a lot of pressure, straining. They don't seem to get the stool out easily despite doing everything right. Sometimes having to use finger to help evacuate the stool, or using water jets to help. So despite all that, they still get the sense that it's not emptying properly. So this is the set of people who have just chronic constipation, not IBS. So there is again normal variation, so pattern that is unique to your own body, where you don't actually have any pain, you don't have any bloating, you feel comfortable, but you might not go every day to pass motion. Sometimes you are traveling, you might miss passing motion a day here and there. You might not actually notice much of an issue. Sometimes there is change in the amount of water you have taken, change in the amount of fiber you have taken. So the next day motion seems to pass smoothly. So not everyone fits into that same morning routine motion template. Many people have variation of their bowel movement. As long as they're comfortable, that's nothing to worry about, even if they go alternate day. When you force your bowel to empty, it can get dangerous, because many Indians abuse laxatives, all kinds of things, including castor oil, senna tablets, triphala, various churans, natural remedies, whatever they can get hold of. So to ensure that they are passing stool every day, that's because they have an obsession that you have to go and pass motion every day. So this starts to give you dependency on laxatives. It can worsen bloating, abdominal discomfort in the long term. It can also cause harm, damage to the nerve signals in the colon, because your colon intestine is not responding naturally. So it's kind of waiting for some external pressure, waiting for some medications to go in to stimulate its movement. Long-term problems with these kind of issues will end up with piles, fissures, rectal prolapse, all kinds of pelvic floor issues. So we need to ensure that as much as possible our intestine, colon should work naturally, not on medications. So when should we actually worry? You should worry if you are seeing blood in the stools more than once, if your stools are jet black in color without being on any iron tablets, if you are losing weight without trying, if you are the age of 40 and above, you are worsening constipation despite doing all the right things, or if you feel that there is a change in your bowel habit which is new, that is getting worse, it's associated with abdominal pain, or something in your own general health is going downhill. So these might not be issues with your lifestyle, wrong food. There might be certain health issues that might require evaluation by gastroenterologist. So what actually improves your bowel movement, your gut health? If you want natural, healthy bowel movement as a gastroenterologist, this is what I suggest. Firstly, fiber intake. Is there adequate fiber in your diet? Check. Wide variety of vegetables, whole grains in your diet, daily fruits. Secondly, water intake. Too much is not good, too little is also not good. So you need the right balance, at least 2.5 to 3 liters of water every day. Good amount of physical activity, even just brisk walking 30-40 minutes a day, because it's the biggest stimulator of gut motility. Most importantly, responding the urge to pass motion. So when you get the urge to poop, you should not keep on postponing, suppressing, because this can cause long-term problems of chronic constipation. For people who struggle with getting the right pressure when they sit, where they're having to strain, you keep a footstool, which kind of gives you a little bit of a better anorectal angle. For people I'm talking who are using Western commodes, because this will give you a little bit of a squatting type of position, which kind of reduces the need to put too much of pressure. So these kind of changes, things matter than actual timing as to when you're going. So healthy diet, it's about comfort. It's not a clockwork. So you don't keep chasing daily bowel movement first thing in the morning. If your stools are passing easily, if there is no abdominal pain, if there is no bleeding, then you're not constipated. Even if you don't poop every day, even if you're going alternate day, then that is absolutely fine. Please do follow Bangalore Gastro Center hospitals for science-based digestive health advice. Thank you.